Welcome everybody to another Women in THR webinar. And today we are fortunate enough to be joined by Mihaela Răescu, Professor in Preventative Dentistry at the University of Bucharest in Romania. So my name is Jess Perkins and I represent a platform called tobaccoharmreduction.net. And it's this platform who is hosting the webinar today. So I'll give a brief introduction about you, Mihaela, and then I'll pass the mic over to you and you can carry on. So Mihaela has authored and co-authored numerous studies and publications and has been a guest speaker at various international conferences. She has conducted several research projects in the field of dentistry and product development as a project manager. And in the last few years, Mihaela has joined the tobacco harm reduction space and has taken part in some THR research studies. And we'll hear more about these very soon. But on that note, shall I pass the mic over to you and you can introduce yourself?
Okay, hello. Thank you for inviting me to this webinar. My name is Mihaela Răescu. You said very nice my name, thank you. And I graduated the University of Craiova School of Dentistry in 1995. After that, I received postgraduate scholarships in UK and in France. And as you said, I authored and co-authored some studies and publications. And I conducted several researches, but the most important thing is that I'm also a dentist and I'm a professor, and I have to combine the information between practical and theoretical skills. So that means it's quite nice to have this opportunity to explain to your students what you are doing in clinic. So in about THR, I joined the team in 2018 when I applied for a scholarship in Communication Action Challenge Foundation. And it was like it was like a moment of curiosity, because I started with, let's say, study a little bit what kind of publications about tobacco harm reductions are in the literature. And I found out that many publications are telling us about the impact of smoking on other organs, and very little about the oral cavity and the impact on oral cavity of smoking. And I decided to apply for this scholarship in 2018, and starting with this year, I joined every year the team of GFN. I applied again for another scholarship in 2019, and I also make some researches with this opportunity. I mean, about the impact.
So what specifically did your research teach you about smoking and health?
Yes, I researched the oral health impact of heat-not-burn products. I mean, non-combustible nicotine products, just because usually when we are smoking cigarettes, we have this problem of having changes in the oral cavity mucosa. And then if you, I just studied if you are switching the normal cigarettes with heat-not-burn products, if there are some good or bad changes in the oral cavity, let's say, environment.
So what exactly did you find were the changes?
First of all, it was a pilot study about the quantity and quality of the bacterial plaque on the teeth of the person who are switching from the normal cigarettes to another non-combustible product. And I found out that it's after switching, after 9 months of switching, we can find a smaller quantity of bacterial plaque, more easy to take off the bacterial plaque. I mean, a very, let's say, the smaller quantity of the bacterial plaque is important, because normally in the bacterial plaque we have a lot of microorganisms, about around 300. So if we decrease the number of microorganisms in our mouth, that means less impact on oral health, less impact on the other organs. So this is important to establish that cleaning, even if it is very often and very easy to say, oh, I'm going to make a cleaning. So the cleaning is important for the entire health, for the entire organism, I mean, the entire body.
So you would say that if somebody switched to heated tobacco products, they would need to use a product for at least 9 months to see a significant or statistically significant change in the oral health in their teeth, an improvement.
Yes, it is true. After 9 months, you can really see the differences, and you can also prolong the period of examining, the monitoring. I'm doing this. I did it with my my patients because I decided to see if this is if the results are exactly concluded. So if the results are in time are exactly the same, and if it is an improvement in the oral health after more than 9 months, for example. But the scholarship was for 9-month study. So I decided to continue because, in my opinion, long-term studies are giving more relevant results. So that's why I started to monitor exactly the same amount of patients that I started with for the study. And it is a very simple study. I think all the dentists can try to do it. I mean, they can observe everything very easy because most of the patients are doing the cleaning. If they are very disciplined, they are coming once a year. So after 1 year, all the time you can see exactly what's happening with the oral cavity. In this use of, I mean, if we switch for heat not burn, it's always a problem to be sure that your patient will keep using only heat not burn for that period of 1 year or 9 months or whatever. I mean, this is something that the patient will ask to do something for himself if he's trying very much to obtain the cessation and he cannot. And you can just question him what kind of alternatives he can use. So this is the reason that he will choose the right alternative for him, for the patient, let's say, if they know exactly the alternatives. And this is what we can do, just to explain them. If they say several times, I cannot quit, doctors, I try, please, what can I do more? Just to tell them how many alternatives he can have, and he will choose knowing exactly what is it all about.
So these people that you did study after 9 months, did you say that you're following up with them long term, so
yes.
year after year, and you are seeing
yes.
measurable improvements in their oral health?
Yes, of course. I mean, it's exactly what I saw, that the bacterial plaque decreased as a quantity and the quality is different, meaning if it is very hard, the bacterial plaque, the cleaning is a little bit painful. I mean, you can remain with some hypersensitivity. And if it is easier to remove it, then the patient will come a little more relaxed to do this procedure.
Yeah, I think you've made a really fascinating start into investigating the effects of switching to heat not burn product and the effect on oral health. Are there any gaps or any other areas you'd like to investigate further that you're currently not investigating? So would you like to extend the study to other products in a more controlled way, or what ideas would you have if you were to continue your investigations?
Yes, it is interesting to do. If, for example, after a questionnaire to my patient, I can find out that maybe they want something else to try. I mean, if they don't want to try, for example, heat not burn, which in Romania now it's a little bit fancy to have it. I mean, it's they start like this, first of all. But if they are, for example, aware of some other alternatives and they want to use it like snus or something like patches or it would be interesting to see in a long-term study how they will react. I mean, how the oral mucosa will react to this. But I can tell you that I also started to see the impact on the bone resorption. I collaborated with one of my colleagues, which is a surgeon, and we we try to make some implants, and in the same time to leave the patients to choose some alternative. I mean, instead of smoking the cigarettes, which brings you as a patient, when you do a surgery, brings you some problems about wound healing. I mean, the process of wound healing is a little bit delayed. So normally we encourage them to forget about smoking during the osseointegration period when they perform an implant. So it's a little bit, so we just took a lot of patients, and with the implant needed treatment, I mean, they needed an implant treatment, and after that they have chosen some alternatives for the osseointegration time, meaning minimum 3 months to 6 months. So what we observed is that after switching, the bone resorption was less. That means it's important for the success of the implant therapy to get rid of smoking, first of all. And if you cannot, you can make a switch. So the bone resorption is going to be less, which makes you a very successful, let's say, doctor in time. I mean, it's a good collaboration between the doctor and the patient. So it would be interesting to see long-term. This is the problem, I think, I mean, a problem, but this is an issue here, to have a long-term studies just to communicate a more relevant conclusions, because after that you can be sure that you are giving to your patient and to your doctors, to your colleagues, the right information.
And in terms of these heat not burn products, or these heated tobacco products, which are the most popular ones that you're seeing people using in Romania?
In Romania, usually they are using heat not burn. Otherwise, it was a very long time, a long period of time when they used vapes, I mean e-cigarettes. And usually my patients, they have chosen the heat not burn products. But some of them told me that they tried also e-cigarettes. Usually, that was exactly I mean, they tried to tell me that this is what they want, the heat not burn.
Would you say that most people who are smoking, who are trying to quit or switch, they would generally go for the heat not burn rather than vapes or snus? Heat not burn are more popular for switchers?
It's more popular, yes. I don't know if they know exactly that they are switching for their own health. They are switching because they want to stay inside and to smoke inside, I mean, inside the room. They smoke, they try heat not burn because it is fancy, because the entourage, I mean, the other colleagues are smoking the same, because they look nice or something, not because exactly they are aware of the benefits or the risk, the profile risk of the heat not burn product. So some other alternatives, not exactly only heat not burn. Just they are trying something else, just because they are in some other circumstances than stay, not because they know exactly how good or bad it is for them, for their health.
Oh, okay. So they're driven more by smoking to be around others for social situations.
Yes,
it's more committed rather than, oh, it's saving my life, it's healthier. So it's more of a social consideration rather than a health consideration. Because
I think in Romania, the tobacco harm reduction idea, it's not quite known. I mean, it is not well known. And I think also even the doctors are not embracing the idea. I mean, they don't know exactly what is it all about. The information, I think it's a lack of information in this area.
Actually, that leads me nicely on to my next question about the tobacco control situation in Romania and about regulation of the products. So can you elaborate on how these products are regulated in Romania, and how they're sold, the advertising?
Normally, I know that the products are regulated in Romania. I'm sure of it. I mean, I know that the products carry the standard obligations, and also they need to be, I mean, the products need to be registered in a European platform. And it is also present in excise for for the tobacco products. And but usually I don't know too much about regulation. I mean, I didn't study exactly. I think the import-export programs are more interested in this something.
Yeah, sure. But they can be bought in retailers and online. You can see them in shops.
Yes, we see them in shops, and also we can find them in the market. It's like, but the advertising is doing only in the shops, in the specific, I mean, it's exactly only for the shops, and in the point of sale, in the professional magazines. So
Yeah.
it's about strictly about the nicotine containing products, and that's all that I can tell you. I mean,
yeah, that's perfect. That's fine. In terms of like, there's a question about tobacco harm reduction and the space in general, kind of higher level than just the dentistry question. What do you see as the main issues in tobacco harm reduction, from your perspective?
I think communication, it might be the most important issue, because we also have to understand that the people are not aware of the risk profile of the products. And also it's important that we have to explain them that until now they are keeping nicotine as the bad actor, the only bad actor in the scene of tobacco harm reduction. So I told you this, the way of communicating is important. And that's why with all the global issues now, and everybody can see, okay, tobacco harm reduction is not exactly what is it the most important thing now. But in my opinion, being healthy, it's the cheapest way to pass in this time. So going to a doctor, monitor your health, and just if a doctor is telling you, look, you have to get rid of smoking. If you cannot, you are doing your best, and you cannot, at least you can try some alternatives. So this is, the communication, I think, is the main issue.
Yeah. And in terms of oral health in general in Romania, this is bigger than just a smoking issue. And where do you think the biggest changes need to be made just to improve the general oral health in the population?
The biggest changes, I think, just because we cannot make advertising about this. This is something very, it's hard to get to the population awareness. So I think maybe the doctors can do this, but first of all, they have to know exactly what to communicate in terms of results, in terms of studies. Usually the doctors believes in one doctor will believe always in scientific research, in well done scientific research, and to be aware of this, they have to just to be informed. If you can, for example, if I'm speaking on my behalf, if I can explain it on some public, let's say, meeting, just to inform my colleagues about the results of my research, they will have their own attitude after knowing exactly what is it all about. So just being informed might change a little bit your attitude to your patient.
But do you think the biggest wins could come from reducing smoking rates or diet in terms of the impact on teeth long term in Romania? So obviously there's sugar, there's the diet issues, then there's smoking, because smoking rates are still quite high in Romania. Where do you think the biggest wins can be made?
All of them are important.
Yeah.
Anyway, smoking is always a factor, a determinant factor, or a factor that will enhance the development of some other disease. we always study this in faculty, that smoking is related to dental problems, smoking is related to periodontal problems, but also it's related to cardiovascular problems and lung and so on. So it's all of them are important. Smoking is one of the most, let's say, impacting behavior on all our body, on all our health body.
Yeah, so that leads me on to my next question, which is about the changes in smoking prevalence in Romania in the recent years. So the overall trend for prevalence of current smokers in the general population in Romania has been moving gently downwards since 2006 by a few percent. Do you think the introduction of alternative tobacco or nicotine products in the market can be strongly correlated with this downward trend in smoking rates?
Yes, I think it is correlated normally if it is well communicated. I mean, if we know exactly what is it all about, it might be a good idea, yes.
Yeah. So the next question is about smoking rates amongst males and females in Romania. So currently 35% of men are current smokers and 15% of females are smokers. Why do you think so many more men are smokers than females in Romania?
Maybe it's about cultural reasons, or I don't know, some other reasons. It's like maybe because men are usually in a social in more social activities always. I mean, they have a lot of time, more time to have social activities. So yeah. I think we can reduce this to the cultural reasons.
Yeah. And what do you think would be the most effective thing that could drive down smoking rates further? What would you, if you had to pick one thing, what would you do ideally? What would you recommend?
To change the lifestyle
yeah.
a little bit. I mean, we have to change the lifestyle, but it's very hard. I mean, it's easy to say, but it's hard to obtain. So I don't know. I'm just thinking about being more informed.
Yeah. Okay. Providing more information, communicating more to people, making them aware of the risks of smoking, having more communication campaigns, perhaps. And do you think,
yes, this is important. Maybe they don't. I mean, even if they are thinking they know some things about this. Finally, if you ask, I asked my patient, what do you know? For example, one patient, I asked him, what do you know about some other alternatives? For example, if you want to quit smoking and you cannot, what can you do more than stay and suffer that I cannot have a cigarette today or something like this? And they told me, I don't know, doctor, really, I don't know what I can do. So it's important to know all the advantages and disadvantages of all the alternatives. And after that, you can choose one of them if you are decided to get rid of smoking. And it's important also the family environment, because if you are the only one who smokes in the house, then you are determined from inside also to quit smoking. Otherwise, if all the family is smoking, also the child will see the same behavior, and in the end, it's very difficult to change your behavior.
And do you think in Romania many doctors or dentists who do have that connection with people in the population who could be very influential? I mean, doctors and dentists could have that conversation like you do about smoking, about the risks, about the alternatives. Do you think they could do more in Romania to educate people to try and drive those smoking rates down and to help people switch to safe alternatives?
It's going to be their own attitude, but I'm very sure that they are not aware exactly about, for example, the results of my study and some other studies, because I'm not the only one who are doing the studies about the impact of smoking or switching or using some other alternatives. But I'm telling you, in Romania, we don't have we don't have this kind of studies, except for these studies that I've done with my colleagues, me and with my colleagues, another one. So we don't have such kind of studies, and the people does not know the the alternatives, not even just to count them.
So you mentioned there are other dentists doing studies into oral health and smoking. Is it just the people that you're working with, or do you know of other experts or health professionals doing similar research in other parts of Romania?
Yes, I saw that they are studying a lot of the periodontal impact, the Hindenburg periodontal impact, for example, because the periodontal problems are, I think, after 40 years old, are present in all mouth, I mean, in many patients' mouth. And maybe this is very easy to let's say, knowledge about, I mean, because I saw that the patients are coming and they are trying to do something for their teeth when the teeth are already mobile. So from the preventive way, I mean, if we take a look as a preventive method to explain them that using a cigarette and making this vasoconstriction always when they smoke might destroy their teeth earlier. I mean, if we explain them earlier, then it will be a very good prevention for oral health in time. So that's why I saw that the specialists are taking a good look of this impact on the periodontal all over the world, not only in Romania, but also in United States. I saw some researches made in England as well about the impact on periodontal disease. But we can find out also about the oncological checkup, which is very important for the preventive of oral cancer. So doing this, it's not only explaining them the alternatives, it's not only a measure of prevention, but it's also a method to tell them that they have alternatives. So if they want to quit, they can have alternatives. In time, maybe they forget also about the alternatives and they will reach cessation. So everything to obtain a better oral health.
Yeah. I have one last question for you.
Yes.
Lastly, in the THR space, is there anybody individually or an organization that you really admire?
Oh, there are so many to admire in this field because it's very difficult to be in front of the public explaining how many differences they can make with the tobacco harm reduction. But as a woman, I admire Mihaela Răescu. If you know her, as a researcher, she has faced a lot of adversities because of her work and research. And also, I can say about Dr. Farsalinos, because he's having a very accurate approach and expertise. And Clive Bates, for his dedication and perseverance. There are many of health diplomats are doing a great job.
Okay. Thank you very much. We do try. Anyway,
Okay.
Thank you for that. I totally agree. Those individuals are, we follow them as well, and they're doing some great things and very outspoken with, their views, which is what we need, is the communication side of things as well to create more impact.